Thank you. Before the session ends, because I think this is a very important session, and I want to make sure that we take a moment to think about what we are going to say to the people in our groups when we go back to our countries. I have seen people that attend these meetings, they attend CML Horizons, they hear from the doctors about stopping, they hear it has to be done in a clinical trial, they hear there's the risks, and then they turn around and don't give the right message to their members. So I think that we have a big responsibility of what we do with the information. Everybody is very excited about stopping. And especially because in Facebook and in social media, you see the people that have stopped. A lot of the advocates, maybe from Europe, that have very good setups, and they have clinical trials and have stopped, and everybody's very excited. And when somebody stops successfully, they get some kind of a status of super cool, and we all want to be like them. But we have a responsibility to make sure we don't let the patients in our country take risks. In most of our countries, there is no good access to PCR. We know this. We know in our countries there's no access. So we know nobody should stop. So if some member come to you and say, should I stop? It's not, we're supposed to not give medical advice, but we can make sure that we say, in this moment in our country, we shouldn't, right? So as advocates, let's make a plan. What is it that we can do so that in the future, people in our country can perhaps stop treatment if with the help of their doctor? And one of the most important things I think that we can do is to figure out how to better advocate for access to good quality PCR in our countries. We should make a plan. How are we going to bring or help bring PCR to our countries so that when we're ready and the clinical trial can come, and then we can have the possibility of some patients stopping. But I think this is very important. We are not here to talk about our own selves. We are here to represent the members that are in our countries and to do everything we can for them to be able to safely live with CML. So I just wanted to make sure that we say that out loud so that it's very clear that what the message is at this moment.